Well, we have 63 people. If you want to start, I know you have a full thing, so I'll let you all begin. And thank you. I'll just thank you everybody for joining our session. And you are in room 2 with Mecca Williams. And the topic today is going to be no wrong door approach. And Mecca, I will let you introduce yourself, and we'll go from there.
Okay. Hey, everyone. My name is Mecca Williams, and today our topic is no wrong door approach, youth substance use, and exploratory conversations. And this conversation will be quite exploratory. And just to let y'all know, I'm still coming down from the high of our keynote speaker, Tania Kane. So I'm still like, how do I move on? But actually, she threw me an alley-oop because some of the things that she pointed out through her experience with the systems that she had to interact with, we'll be talking about today. We'll talk about just how the importance of the integration of those systems and some of the barriers, because we can't talk about integration without talking about barriers and some things that we can do moving forward to mitigate those barriers. So I'll just start with introducing myself. My name is Mecca Williams. As I just stated, I have been in the mental health field for 20 years. I'm an LPC. I currently work at a CSB, Hanover CSB in Hanover, Virginia. I've been working with youth and families for majority of my career. I also do LPC clinical supervision. A lot of my supervision focuses on youth, families, and substance use. What else do y'all need to know about me? I've worked throughout my career, I've worked in majority of the systems. I either worked in them or had some interaction in the systems that we're about to talk about. So that's why this subject is near and dear to me. I understand the importance of the work that can be done and the miracle of the work once all the systems are able to work together, succinctly work together. But we all know that doesn't happen all the time. All right, so what is no wrong door approach? This terminology was not just, I didn't make this up. This is actually a SAMHSA terminology, and that means policies emphasizing the importance of effective systems, ensuring that individuals in need of treatment are identified, addressed, and provided with treatment or suitable referrals, regardless of where they initially seek services. So again, it's about no wrong door. Wherever you get in first, wherever they come in, we should be able to effectively work with them, work with people, and help them navigate the systems and help them make decisions, them and their families make the best decisions about what's going to be needed for them down the road and in the future. And especially when we're talking about change or help. A lot of times they come to in our systems and in our doors by force, not necessarily by choice. That's my experience. So they can be a little bit more, it could be harder to work with them, but once we are able to get them in, it's a lot of trust building and figuring out, okay, what are some of the foundational issues that we can help them navigate? Okay, so this integrative approach in treatment, it leads to reduce or discontinued substance use. That's our hope. Improvement in the psychiatric symptoms and behaviors. We hope to see that some of the symptoms that they present with are reduced or they go away. Reduce interactions with the judicial system, because we know when we are dealing with substance use, there are lots of interactions with the judicial system. That's a lot of times how us on the mental health side end up seeing some of our kids is through their interaction with the judicial system in some type of way. Increase engagement in academics. Another way that we get kids in is through the schools. A lot of times the schools are the ones who identify some problematic behaviors or issues with academics, and they are usually referred to the mental health system. Decrease risk in negative health outcomes. We all know that long-term substance use leads to negative outcomes of health, all sorts of health, your entire well-being, mental health, physical health, spiritual health, all emotional health. It is detrimental. So hopefully when there's help, then we will see decreased risk in the negative health outcomes and improved self-esteem. Another thing that happens with this population is we see just a lot of the foundational reasons why they're using trauma, abandonment, neglect, low self-esteem. All those things lead to low self-esteem. And a lot of times the using is to escape oneself. And substance use, substance addiction is just a disconnect from self overall. So in this presentation today, I hope my objectives are to identify systems of support for integration for the SUD adolescents and young adults, identify barriers to integrating with each system, and some antidotes. Meaning we're going to talk about the barriers, but we're going to also talk about ways that we can combat the barriers, ways we can get around the barriers. Because if there's a barrier, meaning like a wall, it can always be broken down and destroyed. So I don't believe that, oh, it was just hopeless because this is a barrier. That's not always true. It may take, even if the barrier, it may take 20 years to bring it down, it's still a way to bring it down if we all work together and work diligently. Identify ways to engage in healthy integrative practices and the positive outcomes for SUD adolescents and young adults. So we're going to talk about some positive, healthy ways to integrate and engage our youth into our systems. So what are the systems? What's the ecosystem of support that we usually are integrated with? And I'm maybe missing some. I know I'm probably missing some, but these are just some major ones that we see. The family. The family is number one. We don't treat youth in isolation. They did not just appear here by themselves. They come from a system, a family system. So that is very important. They have the family, the caretaker, they have to be integrated in the work that we do. The school system, the judicial system, the courts, the human social service system, which we consider DSS, the medical system. When we think about the medical system, our primary care physicians, our occupational therapists, speech therapists, our insurance companies. That's what I think of when I say medical system, because the insurance company is a huge part of the medical system. And our community system, the community meaning the people that surround us, the people that's in our environment, the local business owners that we interact with, our recreational sports teams, things like that. Those are a part of our community system. And we're going to talk about how each one of them play a vital role in integration and helping kids with substance use issues. The family, let's talk about the importance of integrating the family. So our keynote speaker made a very important point, and I stand on this, I live by this. You cannot talk about working with and treating a child without treating the family. You are going to work with the family whether you want to or not. It's important. It's essential. Because think about it. The child comes in to see us. However, they go back into the system. If the system is not gaining the same knowledge that the child is, the child is essentially being re-triggered, and how are we effectively helping them when everybody is not on the same page, or at minimum, because sometimes the family doesn't want to be on the same page, but at minimum, the family would now be aware if we bring them in and have them play vital roles in this child's care. At least they would have some awareness. And the child will also know my family has awareness. So let's talk about like the proximity of crisis, how the family plays a role into that. So in a crisis, a lot of times I've had incidents where children have, let me not call them children, young people, the youth, had an incident where a young person overdosed in the home and their father was there and found them. So a lot of times the family member they're the first line of defense. They're there with the youth. They can save them. They're there. They understand some of their behaviors, the in and outs. They are historians in reference to the youth behaviors early on in school, and the family system, like grandparents and other people that's in the family. They can be good historians as far as information in reference to substance use, mental health, and the family system. We need to know that information to help treat the whole child. Again, the child comes from a system. They just didn't appear here by themselves. And a lot of our substance use and addiction it's it runs in the family, it's genetic. A lot of times you can trace it back to maybe it's a direct parent, a grandparent, an aunt, an uncle. You can trace some of these things. Awareness is important. Once a family member is aware, oh, this just didn't start with me, because a lot of times the kid feels like I'm the problem. This just started with me. And that's not necessarily true. There's some empowerment and maybe some willingness to change once you understand that this has been in our family history and it's time to possibly break some of these cycles. Not even possibly, time to start working towards breaking some of these cycles. The other thing the Tanir talked about was, as clinicians and as mental health providers and anybody that's playing this role, even if you're not in the mental health part, whether you're in a school, we are merely planting seeds. The other thing a family member, the family can do as an integration is play a supportive role. So the family can be the emotional support. They can be the person that encourages access to treatment. The family members are the people that usually take them to the hospital. The family members are the people that typically rally for their young person, even when they don't really know what's happening or know all that's going on. The family member is the person the school calls, a lot of times, the caretaker. They call the family member. They're the first line of defense. So the family is integral in playing a part in integration and helping the child. Even if we deem the family as dysfunctional or toxic, they're still the family that they live in. And they play an important role. And most times, in most cases, the family, they do want to see their child get help. They do. They may not know how. They may not know that they're part of the problem, but typically they want help for their child. And some of the parents and caretakers that notice that they may be a part of the problem, when they have that awareness and they start to do their own work and make some changes, it makes a tremendous difference and impacts, a positive impact on the child. Also, another thing about caretakers, if they're the legal guardian, they play a critical role in making very important decisions, along with the youth, if they're 14 and up in Virginia, in reference to their treatment. That's another thing. They are the influencer of sorts. So really nothing really happens unless the parent is the caretaker, the family is somewhat on board. Even down to in therapy sessions, talking to the family about establishing boundaries and getting their own help, attending Al-Anon meetings and Nar-Anon meetings. Those things matter. Oh, sorry, I went the wrong way. The school plays a huge part in integration. The school is where, you know how like we spend majority of our day and weeks at work. The child spends majority of their time at school. So one of the main things that the school does that they can be integral in, they pay attention to, they notice attendance. If a child's attendance has changed, they will alert, of course, they'll try to contact the parent. They will bring in social workers and anybody else that they can bring in as far as the school. They will refer out. They will refer to CHIN, the court system. The school plays a major part in attendance changes. They can monitor that. Behavioral changes. A lot of times the child's behavior is right there in school. They're acting out in their environment. When anything has happened or any changes in their use, a lot of times it plays out in school. Whether it's I'm not doing my work anymore, I'm not attending school, or my behaviors at school are changing, or sometimes they're using in school with peers. The school, they immediately can see those things, and that's how a lot of times the parent is alerted and then they enter our system. The school also plays a major part in academic supports and advocacy. If a child is struggling academically, maybe needing tutoring, IEPs, child study, those types of things. If the school is really doing what the school is designed to do, they can play a major role in helping the child get on track academically. Or again, noticing when they're falling off. This is not the same. They were an honor roll student, now all of a sudden they're making all Fs. What's happening here? Also, the school can provide educational programming about healthy habits, about the effects of substances. They can also provide supports as far as recreational sports, clubs, band, other extracurricular activities that can keep a child engaged, which will help decrease any use. We all know if a child is engaged in activities that they love and that helps build their self-esteem, that will help decrease use and increase positive social interactions. Other thing the school does is help build a child's positive social interaction with peers. They get to go into an environment with people that they're friends. And some of those things, some of those activities and engagements can be very positive for a child. The school also can expose the youth to colleges and different types of museums and other technical things that they may not be exposed to in their environment. When I say technical things, like maybe they're not college bound, maybe they're more interested in working on cars or building things. So the school is integral in that type of exposure. And also the teachers and the administrators play a huge role in the school as modeling. They have an opportunity as educators and just anybody in the school, not even just the educators, it's down to the janitors. Every adult in that school building has a major part in modeling appropriate behavior and being a support system for a child who may be struggling. The youth in the school, again, they spend a great deal of time in the school building. So just being in that building, sometimes children in their home environment, they may not have something to eat. The school may be the only place they have a decent meal sometimes, and that could be contributing to substance use. Because think about it, we all know that the foundations of substance use a lot of times is the mental health symptoms, the depression, anxiety, the low self-esteem, the trauma. And a lot of that starts in the environment. So if a child does not have their basic needs met, the only thing they may know how to do to relieve those feelings is to use. So the school can play that role and supports too. Also, in addition, also the school plays a role in providing family members with other community resources like mental health resources and recreational resources and resources for them to get financial supports. The next integrated system that can play a major role, which I think the judicial system kind of gets a bad rep sometimes, but I've seen over the years how the system has changed, as meaning that the judges and the lawyers, they're becoming a little bit more educated about substance use and mental health and how that is a disease. And it's not a lot of the criminality that comes from that is not because they want to be out being a criminal or getting in trouble or having negative behaviors in the community. It literally is in response to what some of the substances they're using and their mental health symptoms. So I'm seeing that change, and the court can play an integral role in holding the child accountable and the families accountable through the CHINS process, the child in need of services or the child in need of supervision. Sometimes placing a youth in detention can temporarily take them out of their environment and keep them safe and have them away from their substances and their negative peer influences. We don't want to influence a child going to detention, right? That's not what we're here for. We don't want that. But sometimes it is necessary to help the child just stay sober enough to get them to maybe a residential. I had a case where it was a young person that ended up in detention, and the court mandated for them to be there until they were transferred to residential, and it worked out. Otherwise, this child would have probably came out and overdosed and would not be here with us. That's how we had to integrate and work with the system. The system had to work with us to get this going, to put this child in a situation that was best for them at the time. Also, when working with the judicial system, treatment providers can help with this negotiating and discussing with maybe lawyers other options such as residential treatment facilities, IOP, intensive outpatient, divergent programs, or drug court, instead of just going the normal route of going to detention, come back out, no treatment. That's a way the judicial system can hold the child and the family accountable, because there's some help that they're getting. And sometimes that help is instrumental because it helps the child stay focused, and some children, they benefit from it. And also, if a youth, sometimes when they go into the judicial system, they are assigned a guardian ad litem, and that guardian ad litem, their sole purpose is to work on behalf of the child and to help make best decisions, help the family with those types of things, and just stay in touch, in contact with the child and family, find out what's going on, to bring that information to court, to again make other best decisions and see if things need to be mandated or things need to be reduced at the judicial level. Department of Social/Human Services, as some localities call it, is another integrative system that is absolutely necessary. When we think about DSS is the hub for when people need medical insurance resources such as Medicaid, which we all know that Medicaid provides all sorts of things, especially for youth and families, such as intensive in-home services, for adults, mental health support, skills building. They fund those types of things, and just medical insurance and treatment. If you need treatment, Medicaid can pay for some of those things for our families that do not have commercial insurance. Also, DSS is good for like food resources. Also, in certain localities, DSS is the housing or the hub for the CSA, and the CSA for FAP team can help families get into services and use additional funding for services that Medicaid may not pay for. So DSS is huge in an integrated process. Also, when we think about CPS and foster care, again, CPS is another system that gets a bad rep, but sometimes CPS has to be involved. Sometimes CPS being involved helps a family change or get help that they didn't know they needed, or it helps identify areas where other systems need to be involved to help the family and the youth. Sometimes CPS has to get involved because the family system is completely unhealthy and can be detrimental to the child, and they have to be removed. And it's just unfortunate when it goes that route, but sometimes it has to be like that. And the system does not want the child to be removed from their parents. Nobody wants that, but sometimes it has to happen to give the parent a chance to get themselves together and the child to get some help so they can sometimes eventually come back together. So DSS plays a huge part in working with SUD youth and integrative systems.
Mecca, we have a question.
Mm-hmm.
Amy asked, can CPS access funds from FAPT or Medicaid if the child is not in care?
Can CPS access funds from FAP?
FAPT, or I might be saying that wrong, or Medicare if the child is not in care?
Can CPS do that?
Yeah. And then
I'm not.
Tabitha just wrote, sure, probation officers, school folks, and child welfare can bring cases to FAPT.
Yes, they
Yes.
can bring cases to FAP, but because usually the cases that come to FAP is usually it starts with the parent.
Gotcha.
Whoever the guardian is starts the process for FAP. But sometimes in some localities, foster care worker, they absolutely bring cases to FAP as well. Whoever's the guardian can bring cases to FAP.
Gotcha.
For additional funding. And again, the FAP team is the Family Assessment Planning Team, for those who may not know that. And is a team, an integrative team that has a DSS representative, a CSB representative, a school representative, and a private provider representative. I'm probably missing somebody else, but that team comes together and helps make the best decisions for youth and their families, and decisions for funding that the insurance companies may not be able to, that cannot pay for additional services that may not be funded through Medicaid or other commercial insurance. So yes, the guardians can bring youth and families. Well, it's for the youth, but it also benefits the family to the FAP team. But there's a whole criteria, I'm not going to get into that now, to meet for FAP funding, by the way. The medical system, let's talk about them. So the medical system is huge when it comes to the integrated process. Back to insurance. Health insurance companies work alongside treatment for providers and referral sources to authorize a lot of the treatment, the substance use treatment. It can, and when you think about substance use treatment, if anybody's familiar with the ASAM criteria, they developed a whole section, and they, as in Medicaid, has the ARTS. That was a whole department within Medicaid to help fund substance use services for adults and youth. The process can be grueling sometimes, and sometimes what the health insurance thinks should happen or the information that's being provided, they may not agree with what we're asking for, but there's ways that we can work together and it's worth it at the end of the day. Because the bottom line is providers, nothing really moves without payment. So insurance is a privilege and it's necessary in a lot of cases to get any type of help in our society that we live in. Health insurance companies also can provide substance use treatment provider lists to families and us, because we don't know everybody. They have the hub, whoever they are contracted with, they can provide that information. Some insurance companies also have what they call case managers or care managers, who also work alongside the providers to come up with more like treatment ideas or funding, think about funding sources and they will let us know what else the insurance company can fund, things that we don't think of. Transportation, for instance. So Medicaid funds transportation for families who don't have transportation to get to medical appointments. And medical appointments also include treatment for substance use and mental health. Health insurance, back to the medical system outside of insurance companies, primary care physicians are instrumental, because if we are getting our youth in for physicals and things like that, they can identify any other medical issues, because sometimes things that present as a mental health issue really is a medical issue. Like sometimes untreated diabetes could look like psychosis, or stomach issues can cause depression and anxiety, but it's really something gastrointestinal. So we may not know this information. That's why we get information from the primary care physicians, and we encourage families to take advantage of their health insurance policy, which majority of them allow free primary care visits and evaluations. So we encourage those things. And sometimes some of the treatment that we refer the youth to, they require an annual physical. And the reason for that is because it's a fine line between what's happening physically and our mental health. And again, we also need information to see whether or not if the substance use has caused any physical damage, so we can get on top of helping the youth out with that. Also, local labs, they're instrumental in the medical system with integration, because that's how a lot of times we find out whether or not the youth is or is not using through urinalysis testing. And we send that out to a lab to find out what they are or are not using. Because, sometimes they don't tell us the truth. And not telling us the truth sometimes can be detrimental to their life. Hospitals and facilities that provide detox care and that can assist with medical monitoring of youth is absolutely instrumental, because sometimes when they go into residential facilities, and it's hard to find a residential facility for adolescents, they don't have a detox component, and depends on what they're using. Alcohol, for instance, that needs to be monitored. And a lot of times we get people into care too through hospital facilities. They will refer them like, hey, you need higher level of care because you're here for an overdose, or you're having DTs from alcohol use. So the medical system, as much as sometimes it can be challenging, but they're absolutely necessary and very important. The community. A lot of times when we think about integration, we don't think about what's out in the community, what other resources. We try to manage everything within the medical model, meaning the mental health system, or the medical system, or the school system, or the DSS system, or the judicial system. A lot of times we don't think about what the community can do. Neighbors, friends, extended family play a vital role in supporting families as they navigate through substance use with their young person. They just do. Sometimes you need neighbors to watch out for your kid. Not even coming to the house to babysit, but maybe just paying more attention when you see them in the neighborhood to inform the parent of things that they see that's out of the ordinary. Also, friends, they could be a great support and helping somebody to talk to. Also, if you've had this experience before, you know someone who's been through this, telling their story can be very important and helpful to the family. Local recovery meetings are housed in the community. They're housed typically in your local churches or other facilities. They're in the community. That is instrumental. Local recovery meetings for the youth and family support meetings are in the community. Family support partners, they are instrumental. Family support partners are, they're housed usually at your local CSB or other people, private providers have these people. Youth support partners are instrumental. They're fairly, I don't want to say that they're new, but what family support partners and youth support partners do, they have lived experience with often addiction and or mental health, and they can be an emotional support and a resource support for families and youth. They're instrumental, and they work heavily in our communities. State agencies such as Department of Behavioral Disability Services, they provide funding that for licensed residents to help with their supervision that targets substance use. And they're in our community, and that knowledge and that education will help our youth once you start to gain, because we don't learn that stuff in school, in our grad school programs. We get the classes, we take a semester, but we don't learn in real time how to work with this specific population. And it can be difficult and challenging sometimes. So having that additional funding for supervision is instrumental. Local news, that's community. They provide information on community forums for youth, because there are lots of teen forums, which again is a positive outlet of being around other positive youth, goal-oriented youth that could really help the youth and the family. Local news also provides resources for financial resources, food resources, especially around this time during the holidays. You find out more about food pantries. What do you call those? The tree, the giving, I don't know, they're not Christmas trees, but I forgot what they call those Christmas things that they do.
The angel trees.
Yes, angel trees, thank you. Angel trees, things like that, things to help families during this time, and maybe throughout the year. There are other resources. Also, the local news provides information on changes in law when it comes to substances and substance use, and statistical reports and information about substance use trends amongst youth and adults. Also, in the community, that's where your recreational facilities are housed. Let me not say most, because now I used to think with the most attitude, but now I'm more familiar with rural counties that don't have a lot of resources, but a lot of places and cities that have resources, financial resources and people resources, also have local recreational facilities that have sports, arts, volunteer opportunities, anything you can think of, whether it's boxing, mentoring, all those things that would help youth in their journey and to decrease the substance use and addiction. And also with modeling, I'm big on modeling, adults modeling and appropriate behavior and other ways to live. That stuff helps and resonates with children and families and will help eventually break cycles. So again, community is a major thing when it comes to integrative approaches. Okay, mental health providers, that would be me. I'm one of them. Like the majority of y'all are one of them. So the role of the mental health providers play an integral role as well with assessments and screenings. So we have the tools and the knowledge to assess and screen, and we know what to look for to indicate the appropriate level of treatment for the youth. Sometimes when we see youth, they come in just for standard outpatient, but we do the appropriate assessment and screening, we'll find out they may need a little bit more. That little bit more may be an an intensive outpatient program. In addition to recovery groups, they may need residential, they may need a partial hospitalization program, they may need an MAT, and I forgot to mention MAT, talking about the medical providers, but MAT is medical assisted treatment. That's to help with any type of cravings. That's necessary. Like, we able to like assess and figure out, okay, what is the best for this youth? So what we think is best at the time to help treat with the treatment. Again, you have, but you also have to, we have to work alongside these other entities for integration to get things done. Also, mental health providers, when we're trauma informed, we can provide trauma informed care. The keynote speaker talked about how instrumental, how important trauma informed care. Again, when you think about substance use and addiction in particular, a lot of it, the foundation of it is some type of trauma. And our approach has to be a little bit more than standard talk therapy. We have to approach it from a lens of trauma. And not all of it can be also just talking about the substance use and why you're using and those types of things. It's really about, again, what happened. We have to go back. We have to figure out what is the foundation and some of the issues that the youth is struggling with. Even when they may not even, that's the interesting part about youth. Sometimes they're not aware and they can't identify readily. But the more we provide a safe space and have trauma-informed approaches, then we can get to the bottom of some things. Also, we provide a safe space for them. Trust, back to trust. Trust is very important. In order for us to help and do any type of work, they have to trust us. In order for them to trust us, we have to provide a safe space. We have to provide a space where they feel that they can be themselves and be honest with us. That's the only way we can really be effective and help them. Also, we have to know when I may not be the right person for this youth. As a mental health provider, we have to know that sometimes and refer them out to the appropriate person. Also, we're instrumental in helping the youth and family normalize this experience. There's a stigma when it comes to substance use. So a lot of times they feel ostracized or isolated or othered. So we have the ability and tool and knowledge to help normalize and like, no, you're not the only one. This can be, you can get help. This can change. You're not doomed. There is hope. Also, we provide psychoeducation to the youth and family on the SUD diagnosis, the symptoms, the co-occurring mental health symptoms, other resources that may be necessary to help with both. We also provide information instrumental to linking youth with other community recovery resources. Again, we have to, once we know about these things, we're able to connect them to everything that's in our reach. Psychiatrists and nurse practitioners, they're instrumental in the mental health world because they can complete evaluations and prescribe the MATs or other psychiatric and psychotropic medication and provide education on the medications. A lot of our youth and families are leery of taking any type of psychotropic medication. They're leery of the mental health system a lot of times, but let alone then you're adding on, hey, this may help with your anxiety. This may help with this. It's scary. But informed and a knowledgeable psychiatrist or nurse practitioner can definitely be instrumental in the education piece with that and helping families feel comfortable in their decision. Case management in the mental health system is a big deal because the case manager is usually the one in the middle providing the connection and links to the integration. If there's a case manager involved, they're able to coordinate treatment team meetings. They're able to get with other providers to make the best plans and decisions, share information for the youth. Because a lot of times when a case manager is not involved, it's one person isolated, whether that one person is the therapist or the doctor or the recovery specialist. they're doing isolated work and it's hard and we're all busy, it's hard to just, hey, somebody needs to be the person in the middle to connect all of us to meet on a regular basis and be strategic about the care and bring in the youth and family in these meetings as well, because they ultimately make the decision about their care. But once we all get together and we're on the same page, things can move a lot smoother and in a succinct way that's helpful. Okay. We just went over all the systems and how they can be helpful, but there's some barriers, and overcoming barriers to integrating in systems for youth and their substance use. It's important because that's a lot. I spent a lot of my day talking about the barriers. Like, I was like, for instance, if I'm talking to a person and they're like, I had a meeting with the school and the school doesn't seem to understand that this person's mental health symptoms, or I was talking to the lawyer, they don't seem to understand X, Y, and Z. Those things can be huge barriers, and sometimes you feel defeated. So we have to talk about ways to how we can collaborate better. How do we foster better communication? How we share experiences and expertise, how we're able to listen to each other, and how and understand each other's systems and how each other's systems work. Because at the end of the day, the whole goal is, hopefully for everyone, is that we are helping a child become more successful and decrease all the issues that come with substance use. And we're helping a family become more successful in how they navigate the world and help their youth and think about changing some things and how they live their lives. That's the hope for everybody, every system. But sometimes we don't understand each other. And again, part of this is being coordinated and strategizing. Again, I want to emphasize there's no wrong door approach. It's really about how do we utilize each other and have the best outcome for these youth and family that's struggling with substance use. Okay, let's talk about some of these barriers. Lack of access to substance use providers in the youth locality. I know that some of you all probably have experienced this. And when I say lack of access, in some rural parts of our state, Virginia, for instance, when I'm talking about, hey, Kate, why don't you refer them? They sound like they need higher level of treatment. Maybe they need IOP. Some areas don't have an IOP, an in-person IOP. A lot of times, then I'm saying, okay, online IOP. Some families don't have the internet because they live in some of these rural areas. So what do? It's a barrier. Or residential treatment. A lot of youth may be at the point where they need residential treatment, and it's difficult to find residential treatment for adolescents. Very difficult. It's a lot of times it's waiting lists. It's all sorts of issues, but sometimes it's not accessible. Depends on the locality. Sometimes therapists are not accessible because of the locality. The therapist, they may have one or two providers and there may be a waiting list. And the therapist may not specialize or have any knowledge or work and experience with the SUD population. That could be a barrier. What do we do about this? So to address service gaps and substance use disorders among youth, one of the things we could do is contact their insurance providers, find out what they have. Because again, we may not know everything. Is anything in 30-mile radius? Is it anything that we can get the transportation, Medicaid transportation, or if the family has their own transportation, is it something that they can access that we may not know about? Also, maybe there is a provider we may be aware of that is looking to expand. They might be outside of our locality, maybe contacting them and have conversations about, okay, how can you expand? Are you willing to do some work in this particular area? What does that look like? That may take a little while, but I've seen that happen. Also, advocating for policies and changing and policies at the federal and state level to increase funding for providers in certain areas. Because it's like certain localities, they just get looked over. Another barrier, stigma and shame. I just mentioned that. That's a huge barrier. Sometimes our youth and families don't seek help, like the full help, don't take all the help or seek help at all because of the stigma and shame. And I want to add to this, sometimes it's normalized. The stigma, shame, and normalization of substance use. Certain substances, it's normalized in certain households. Alcohol, for instance, or marijuana use. It's simply because of the lack of awareness about how this is causing, these things are causing a track to straight up addiction. So it may not be a problem for the family. And again, back to the stigma and shame, there is a stigma for substance use and mental health issues in certain families. Like, oh, you don't have a problem. There's nothing wrong with that. We're not crazy. What do we do with that? That's a huge barrier. One of the things we do is we create, when they come to us and we notice that there's a stigma, whether the parent has a stigma, the child has a stigma, we create a safe space for the youth and family to talk to us about their use without fear, judgment, and raise awareness in our communities about how this is a stigma and what to do about it and how to break the barriers. The more we talk about a thing, the less shame is attached to it. But the conversations have to take place in our communities, our schools, and within our families, because this is a public health crisis. It really is. And if we are acting like this is a stigma and it's not talked about enough, it perpetuates more of the same. And then we got children out here dying, all because of this. Lack of family support and engagement. That's a huge barrier, a huge barrier. Again, like I said before, a family can play a huge role in getting a child into services, but they also can be a barrier. If these behaviors and use is normalized, that's a barrier. If the family is unwilling, they don't believe in any type of mental health help, and they're unwilling to bring the child or participate in anything, that's a barrier. But it's a barrier. The antidote to that is it has to be addressed. We have to address it. We have to address the inconsistent family engagement. We have to address it directly with the family members sometimes. And talk about what the outcome is as a whole to the youth if this continues. We have to address it from a standpoint also of talking to the family about how important it is and how they can really help build a child up through their participation, how they are the model.
Hi.
Did somebody have a question or say something?
It was
Okay.
Siobhan. I just said hello. Somebody had said hello, Siobhan, and I didn't know who it was.
Oh, okay. So yeah, family important is family support, family, lack of family engagement can be a huge barrier, but these are something we can definitely encourage the family, but be direct and informative in our approaches. Also psychoeducation, just consistently educating the parents and the youth on the impact of substance use, the long-term impact, the current impact, and the importance of how once a family becomes emotionally supportive and involved, how that makes a child feel important. Family therapy, that could be a huge part of breaking down the barrier when a family participates in family therapy. They can also promote continuous psychoeducation and sustain engagement, because now maybe sometimes the parent doesn't feel like they have a role or this is their problem. But once they start participating in family therapy, they can see how they can be a trigger sometimes, or they can be a help. It's not just the child. Other barriers, lack of trained SUD therapists and knowledge of resources. That's a barrier. Like I said, in some localities, there may be therapists, but the therapists may not be trained to work with this particular population. What do we do about it? We encourage clinical staff engagement in substance use trainings, trainings offered through literature, facilitating pairing with experienced supervisor. Just pair them with someone, a supervisor who has that experience or a colleague. Also, just because a lot of times what I noticed with some of our mental health providers, they don't have an interest because it can be, the population is hard. It can be hard to work with this population. So they may not have the interest, or it may be some fear, like, I don't know what to do. But once it's encouraged and they see that this is a growing population and it's almost inescapable in some ways, in some respects, whether you're working with a client that has a family member that is struggling with addiction, or had a family member that was struggling with addiction, they may have come from that, or they are struggling with addiction, it's kind of unescapable. So it's about encouraging clinical staff to attend SUD focused trainings, ASAM trainings, and work with other colleagues who have that experience. Okay, so now this is going to be interactive. We're going to all chime in on this. We're going to practice. I'm going to name a particular barrier, and I'm going to have you all talk about an antidote, because you all have experience, I'm sure, in some of these areas, and we can all brainstorm together. Again, this is about exploring and integrative approaches. So we're exploring and we're learning from each other. And so the instructions are to put some of the barriers in the chat box, and we'll look at those and discuss it. Well, not the barriers, but the antidotes. Okay. First barrier we're going to discuss: lack of family transportation. What do you think the antidote? What are some things that we can do as an antidote to that barrier? And can I see the chat box?
If you can't, I can read it to you. We have Medicaid transportation, telehealth, internal transportation with our CSB, use public transportation, identifying free transportation, HAP vouchers, medical transportation, tokens for a cab, fund transportation, Metro cards, tokens, funding for transportation, medication transportation, and family support. There are a lot.
This is a lot, and listen, y'all had some I didn't even think about. This was good. This is really good.
Yeah, virtual services, bus tokens, cabs, Metro staff, CSA funding.
Okay, let's see what I have. Those are excellent. Medicaid transportation, absolutely. Because the number one thing I hear is, I didn't have, the car broke down, I don't have transportation, this, that, and the other, right? So Medicaid transportation, instrumental. Also, somebody mentioned engaging in online treatment. I have that up here: online therapy, online IOP, on going to doctors. You can consult with your physician online now. You can go attend an IOP. You can attend a partial hospitalization program online, and online therapy, and attend recovery meetings. It's a recovery meeting platform, but this is for adults. I haven't found one yet for youth. If y'all know any, let me know. But it's called intherooms.com.
Alyssa wrote McKinney Vento services for youth in schools. Homeless youth in schools is for McKinney Vento.
McKinney Vento.
Mm-hmm.
And that was a policy for youth that are deemed homeless/unhoused.
Correct.
And they can continue attending their homeschool.
Mm-hmm.
And they will be provided transportation through the school. Yeah, this is good. Wow. Other barrier: lack of care team collaboration. I hear that. Okay, this is the one I hear the most. Like I said, hey, like this, I'm trying to try to get a meeting with the school personnel, or the psychiatrist, or the therapist, or the in-home worker, or some other the OT specialist, some other medical provider. What happens? How do we get over? What's the antidote for lack of care team collaboration? Because it could be a barrier sometimes, trying to get everybody together to collaborate and be on the same page. or somewhat the same page?
We have services in school, using a sidekick counselor, CSB, base management, family support partner, family advocate.
Okay. Family support partner, family advocate,
Mhm.
the CSB, the case
Case
manager,
management, mhm, and family-
CIS in schools.
Correct.
We're in a Smoking Gardens or something.
Okay, let's see what I have. So I simply said all those ideas, yes, collaborating, bringing those people in to help get the team together. Cultivate collaboration with support systems, actively participate and facilitate regular team meetings. Meaning if you are the CIS person or the case manager, I think one of the key things is once everybody understands we're going to do this particular meeting every month or every 2 weeks or whatever amount of time, everybody tends to be on board because they understand the importance of it. But if it's inconsistent, that's when you kind of lose people with their time because everybody's busy. So having consistent meetings with all the partners and players really matter, and keeping in contact, let everybody being on the same page, whether it's through email or brief phone calls or something, just being in the loop.
And I have some more that came in,
Okay.
multidisciplinary team meetings, family partnership meetings, school-based clinicians at schools. Our CSB has school-based outpatient clinicians, CSB and court services units linking to collaborate to decrease misinformation from being reported in court from professionals who aren't experts in the mental health field. Effective and structured communication, and educate parents on the importance of collaboration because of their time. Our community is not accepting of too many people in their business.
Yes. Yeah. And y'all know this. Sometimes the parents don't want too many people in their business or us collaborating. That's done by design. Depends on it can be some splitting going on. Like that's another reason why we have to come together on a consistent basis, because sometimes the parents, they tell one provider one thing, something else, another provider has other information. If we're getting different information, then yeah, we're not moving in the same direction. It's kind of like we got to get together, we got to get in the same car, we're going on a road trip, we got to move in the same direction in order to best help this family. And when a family knows that we're all in contact with each other, they're less likely to split. There's some good stuff. Other barrier, lack of access to culturally competent providers. And when I say lack of access to culturally competent providers, I've encountered multiple times where we have non-English speaking family members, and we don't have the staff on readily available that speaks the language of the family member, and it's a barrier. It's so much of a barrier where like that non-English speaking parent, caretaker, family member, they're not involved in a lot of the meetings. They don't really know what's going on. They're missing out on some of the psychoeducation. They do the bare minimum, and it's not their fault. It's because we don't have the resource, and the resource is people that speak other languages. How do we get around that?
I have one here, reach out to DBHDS for assistance. Use the Genie app through Credible if you have that EHR. Provide trainings with current staff, advertise openings in more diverse areas, provide translation services, hire diverse staff, other interpreter services, contract out for services, utilize interpreters. I have been working with the SUD profession for over 30 years. I totally agree. Understanding and respecting culture is so important. Interpreters, family members who can support or translate. Interpretation provided for all communication, translate documents wherever possible. And this is just me personally. I don't know if there's any kind of app that, where you speak into the phone and it maybe can translate. I don't know if that's something that would be free. That I don't know. Someone asked, what is the Genie app? It's Jeenie. I have not heard of that.
Hey, it's Molly from Eastern Shore CSB.
figured it was easier just to talk than try and type it out. It's basically it's an app that's within Credible. So we use Credible as our EHR. And so what happens is you download the app on your phone. We have work cell phones or whatever. And so and then you choose whatever language you need. Can everyone hear me?
Yeah.
Okay, cool. You choose whatever language you're needing to be interpreted. So in our area, we are very, very rural. We do not have a lot of resources. We've used the Genie app for Haitian Creole. We've used it for Spanish speaking. We have a very significant population that are migrant because of the agriculture and aquaculture in their region. We've used it for actually sign language as well. So ASL. So you just pick the language that you need and there's a real person that will come up, and it's obviously HIPAA compliant because it's within the EHR system, and they will actually interpret real time with you, with a face while you're meeting with the individual. It does cost some extra money. So no, that's always a factor. But we found it to be a really valuable resource. You can use it on the road for our case management programs, can use it in session with our outpatient programs. You can also use it from the point of engagement with our peer recovery specialists. They've used it as well. The only time I would say it would not be appropriate to use necessarily would be during group sessions, because not everyone may feel comfortable with that, but it might be fine. We just haven't used it in that capacity as of yet. So definitely get with your IT people or your EHR people if that's something that you are interested in.
Thank you. That's a great idea, Jeannie, because we have Credible at my job. But
Yeah,
I definitely have this.
yeah, it's great. I really like it. And then once you get like the whole login and you get it download, it's pretty seamless. Because like I said, it's an app. So
Some other things before we wrap up with the cultural competence, some other things I want us to think about when we think about culture, not just language, it's other aspects of culture, religion, which I don't think we talk about enough, race, sexuality, gender, it's other forms of culture. And if we have clinicians that's not culturally competent, we're not going to know everything, right? Like we still human beings that live in our own world. It's impossible to know every facet of one's culture. However, it can be damaging to the people we work with when we are operating from just a monolithic standpoint on culture, which is our everyday, whatever our culture is, whatever our religion is, whatever our socioeconomic status, race. If we're only operating from that standpoint, it could be definitely damaging. And if you don't want to build trust, operate from that. Like with the assumption that this is the norm and everybody does this based upon how I live my life and where I come from in my culture. So those are some other things to think about outside of the language barrier. Those things can be a barrier too. Okay, so lack of access to cultural, what do I have up here? To address cultural humility, provide training for treatment providers. I think training is instrumental, ongoing training on cultural competence. Also, I would like to see, when we think about training, I want to see more just changes when we go back to our education, the route through our grad school programs and our schools. Like some changes there, because it's still very, I don't know, Americanized, I would have to say. What else do I have up here? Partner with community supports, including translators, cultural brokers, and address systemic stigma and discrimination within both the youth and their families. So back to other forms of culture, there are definitely stigmas and some discrimination, and that definitely, we have to hold space for that and address it. And that's ways to build trust and to effectively help. Because if we don't understand the stigmas and the discrimination that happens in one's culture, then we're really not helping. So cultural competence is key. Oh, I went too fast. Next barrier, Extremely punitive or lenient judicial systems. We've seen this where sometimes we walk out of court like, dang, they let them get away with that again. Or like, dang, they just one charge and they're in detention already. They just went to detention. What do we do with that? That can be a barrier. Because in and out of the judicial system and detention, I don't know if that's always the best answer.
Hey, we have inconsistent consequences being provided. Best practice court training, cross systems collaboration. Ombudsman educate parents and youth on their rights, record court proceedings, hire advocates, link to legal aid. DJJ outpatient clinicians, opportunity for voluntary outpatient treatment prior to being mandated. There needs to be a desire to change and to be uncomfortable, to learn and communicate and to continue to learn, not say let's change, but still be moving in the same ways.
Facts. Yes. The desire to be open to change. Like the way, this old way is not it's not working. Again, I'm gonna give an example from a rural community. Working with a rural community, their court system it's almost like they're in 1992 or something. They believe like if the kid just pretty much is respectful, that's, obey the rules, that's it. They're not holding the parents accountable for anything. It's just the whole problem is the kid. The kid would just say, yes, sir, yes, ma'am, you will be fine. You wouldn't be here. And we all know it does not work like that. Sometimes the judicial system can be instrumental, especially through routes of chance and things like that, by having the parent do some work too. They're not, again, the child is not isolated, but if we continue with this mentality of the child is the problem, the work is not fully being done. And a lot of times, in the example I just gave, the judicial system can operate from that standpoint. Again, I also have seen in other localities where the judicial system that's come a long way and they're aware of the issues with substance abuse and mental health issues. Any other thoughts on this? Because you gave a thorough explanation of things that can be done. Anybody else?
Nope.
Okay. So I said the same thing, actually like provide training for judicial personnel, prioritize rehabilitative treatment for youth by promoting regular communication between guardians and the guardian ad litem and collaborating with the courts more. This on an ongoing basis through the child's lawyer, through their GAL. It's hard. Sometimes you don't have access to judges, but the lawyers and like someone said, advocating, empowering the parent to contact people that's in the judicial system and advocate for their rights and link them to legal aid. That's absolutely needed. Okay. Another one, a challenge round. Y'all killed the other antidotes. This is a big one. The child. What happens when the child is the barrier? What happens when the child does not want to participate in any services? And everybody knows that they can benefit from some help, but for whatever reason, they are resistant. How do we help? What do we do about that?
I have respectfully ask if the child wants change first. Just as the keynote speaker was talking about, earn their trust and give them a reason to. Educate and respect their autonomy, continue to offer opportunities for treatment, motivational interviewing, try YSP services. Motivational interviewing can be a great tool. Ask the child for their reason of being uninterested. Noticing progress, even the small ones. Progresses, even the small ones.
Yeah, I agree with all those. It's when a child, again, a lot of them, come in and not really realizing that they have a problem with their substance use. They want to be left alone, a lot of them, but they usually comply because they're with the courts or their parents are making them or something like that. But I've run across a few times a youth who's just like, no, I don't want to do any of this. So those are great ideas. So one of the things I've jotted down was just to integrate the family in sessions. So if you actually have the child, you have the ear, you work with them on in just individual therapy level, start having the family come into the sessions and see if that would be helpful. Explore alternative modalities that may be of interest to the youth. Sometimes just taking the conversation off of their behavior or their substance use, maybe having other types of conversations and navigating that into treatment, whether it's arts, music, narrative, experimental stuff, movement therapy, something. Collaborate with people that the youth identify as trusted adults in their community, whether it's someone at school or in their family, to assist with progress towards encouraging the child to participate in SUD treatment. Utilize integrated treatment that switches the focus from the substance use to co-occurring mental health disorder and associated behaviors. Like I just said that, just repeated myself, but those are some of the things that I think would be helpful. Just basically bringing in the family, collaborating with any trusted adults, also switching the subject matter, and sometimes you can get that ear and bringing it back around, because it's also a part of because it takes, sometimes for some children, it takes, I'm sorry for calling them children, some youth, it takes them a little bit longer to build rapport. So we got to take a different approach sometimes outside of our normal thing that we think is necessary and needed.
We also had added on there, be non-judgmental and reward the small and the big progresses.
Yeah. Just the little things, anything you notice, even if they're just them showing up to sessions as scheduled. That's a big deal for a child, a youth that is like, I don't want help, but they continue to show up. Just applying them for those types of things. That's progress. They went from 0 to at least I show up to these sessions on time for whatever reason. Okay, let's talk about healthy outcomes for youth when the systems work together. We identified the systems. We talked about the barriers and the antidotes, but let's talk about what are some of the benefits when all the systems are able to collaborate. When we get around the barriers and we are able to come together, what is the outcome? Okay, comprehensive assessment and treatment. When integrated care is provided for substance abusing youth, it can lead to healthier outcomes and improve overall well-being. And here's some of the potential benefits. Comprehensive assessment and treatment. Integrated care allows for a thorough assessment for the youth's physical, mental, and substance use health needs. The holistic approach ensures that all aspects of their well-being are addressed and leading to more effective and targeted treatment interventions. Long story short, if they're being assessed properly and we're able to collaborate with all parties that's necessary, then we can see some different outcomes. If everybody's working together and the youth is participating with all systems, then maybe we can see some healthier outcomes because everybody's on the same page and the youth is getting their needs met in those ways. Coordinated care and dual diagnosis treatment. Integration care brings together professionals from different disciplines, such as substance use counselors, mental health therapists, medical providers, family support partners / youth support partners, social workers, so forth and so on, school personnel. This collaboration promotes better coordination and care, reducing fragmentation and ensuring all aspects of youth treatment, and that their plan is moving forward. So we have, again, it's like redundant. It's the same thing again. The assessment piece and the coordination piece, same outcome. If everybody's collaborating and working together, then we're moving forward, and it reduces, okay, this person over here is doing that. This person over here knows about this. When we're able to work together, the youth we're on the same page. We're having the same messaging. This is what I'm doing. This is what, okay, you're doing this over there. We're able to also remind the youth when we each see each other, hey, didn't you discuss this with your therapist? You said that's last week. the medical physician. Hey, did you talk to your youth support partner about this? We're all reminding the youth of who's in their life and how the ways that they can help and go to them as support. Continuity, family involvement, and holistic support. Another positive outcome. So when there's integrated care and it takes a holistic approach and the families involved, sustained recovery by promoting continuity across treatment settings, it involves family for support and coordinations. We're considering social determinants. So back to breaking cycles, when the integration is integrating as it should and moving forward, you have the potential to break cycles that has been perpetuated in these families year after year, generation after generation. It can be broken right then and there from the youth or another family member, because they're all involved, they're all getting the same information, and they're getting help and they're seeing the benefits. It can stop right there. Because again, this child is not in isolation. This issue did not just start with this child. 9 times out of 10, this is generations in prior to this child being thought of or coming to this realm. So by us working with the youth, bringing in the family, it could literally stop the direction of that the family was going in generation after generation and change the trajectory and the epigenetics and the generational trauma. This can cease by integrative supports. Again, it's draining. I recognize it can be draining. It's draining, trying to collaborate with everybody, the notes and the care for the youth and the family. And if you have several youth that you're working with, it can be definitely draining, but it's worth it. It's going to help and work for someone. And then that person goes off in the world. They become healthy. They have healthy relationships, healthier families, and so forth and so on. This is a battle. Substance addiction, substance use is a battle that we can all work together to fight, because it's a fight. Okay, so we have a few minutes left. I want to just take some time for questions and any other thoughts about integrative approaches, because we're in this work, and what else can we do to help? Questions or comments?
I did have one question, and this is just about your PowerPoint. Would you be willing to share the PowerPoint, or should people contact you if they have questions?
Sure. So I can
Okay.
share the PowerPoint.
Okay.
I can share it with,
if you want to share it with Elaine, and then she can
Yes.
share it to everybody that's on
Yes.
the call, that'd be great. Okay.
Yep, I can share with Elaine. I can be contacted. My email address. Oh, that was the wrong email address, but that's you can use that email address. It's there, missmlwilliams77@gmail.com. I'm on social media, but you can contact me and I can share it through that mechanism, or I can share it directly through Virginia Tech Elaine.
Okay.
And thanks for having me, because this was this subject matter, again, it's near and dear to my heart, but it was so much to think about and to process. All right, which direction to go in with it, because there's so many ways, but then it's also so many barriers. And again, my conversations is mainly about the barriers, but I know that it's possible to get around the barriers. We can all do it.
Right.
Even when we get frustrated with some of the people that we're collaborating with. And I didn't address that. Sometimes we get frustrated with some of the people we collaborate with because we feel that they don't understand the things that we may know about the youth, right? And how do we get around that? How do we try to understand their perspective instead of becoming, it can be frustrating, but instead of getting caught up in the frustration of it all, just think about understanding the system that they come from. And okay, how can I just provide some information, and you don't have to continue to, but also remind the people that you're working with what the goal is.
Mm-hmm. And I have another question here. How do you approach a case where a child is interested and invested in treatment, but their parent is not supportive or involved? That's a good one.
That's the worst. I've had some of those. So the good thing is that the youth is invested. And if the youth in the state of Virginia is over the age of 14, they can consent for their own substance use treatment. That's the good thing. The barrier to that is if the parent is the person that's transporting them, that could be an issue. But encouraging the youth to participate, continue to participate, to try to continue to link them with school or some community supports that can be beneficial to them. Have them think about, if you know anything about family history, remind them of family history and where maybe the parent may be coming from. They just may not know. So that the youth will not get caught up in so much holding it against their parent, but moving forward in their own treatment. Continue to provide a safe space. And also you have to assess whether or not, like, is a parent neglectful now, like as in the child's supposed to take medication or something like that, and they're not giving it to them? That's a whole other ball game that may be called for a CPS report. But if it hasn't gone that far, really just encourage the youth to continue to participate. Also invite, if there's any opportunity for it, if the parent is willing to, invite the parent in for some family sessions to have the parent discuss like just their stance, what they think. Because sometimes the parent wants to feel heard.
Mm-hmm.
So if they're willing to do that, invite them in for just some family sessions and find out where the family member, the parent, is willing to be supportive to the youth. What area?
Good. Is there any other questions for Mecca, or any other comments or anything? We have a whole bunch of thank yous and for sharing your information and all your knowledge. So I want to make sure I pass that along to you, Mecca. Any other
Thank you.
questions or anything for Mecca? A lot of thank yous. And
Another thing, sometimes we're working with our family members, and well, not our family members, but the parents. Sometimes we have to have conversations and encourage them to seek their own help, whether it's individual therapy, their mental health, for their wellness and their well-being, and taking an approach and being empathetic to the job of parenting can be hard sometimes.
Right.
Again, sometimes they want to be heard and they need their own space. So that might be part of the problem.
Another comment. I always have both the parent and the youth attend a number of sessions together, sessions in the initial assessment process. It usually helps break barriers.
Yep.
Yeah.
We can start right there during how we do our assessments. That's a key point. Are we rushing through, or are we taking our time and helping the family feel seen?
Right.
Because they may want to participate a little bit more.
Exactly.
But you're welcome.
Yes.
My pleasure.
I do know I'm going to be saving the chat. So any of the questions and answers that we got in here, especially about the genie, and there was another one about language line, I believe, and I will make sure language line is interpretation services. So I will make sure that gets out to everybody as well. If we want to, we can just click on leave the room. You don't want to leave the meeting, leave the room. And I think there's just a little bit of information about tomorrow, and then you all will be good to go. You all could just start leaving the room when you're ready. If you have more questions for Mecca, you go from there. Thank you, Mecca.
I'll share the
Thank you.
presentation.
Oh, wait, Patricia, you're talking, but you're muted.
Oh.
Thank you so much.
Oh, you're welcome.
So much information.
It was a lot of information.
Yes, yes.
It is so much more. Thank
To
you.
a different level. You always can learn. When you stop learning, you stop living. You could be in a profession for 20, 30 years, but if you don't learn something every day, what's the point?
That's true. And I came on here thinking, I was like, oh, they know this stuff.
I learned something new.
Yeah, me too.
You
I
and
learned
Miss
from
May.
y'all.
Yes, I'm glad
Thank y'all. Have a good day.
Mac, I have one question. I'm sorry.
Okay.
Does I have one question? This is Annette. Are you willing to share your thought on our judicial system when it comes to the youth, where the judicial system sometimes just throw around mental health diagnosis regarding the youth and how they can sometimes it can hinder or make the charges a little bit worse than, I mean, not the charge, but the consequences a little bit worse than what they may have been.
See,
when it comes
that's where we come in at. So, they don't, how do they know? They get information. They're getting their information from somewhere. A judge or a lawyer cannot just come up with a random diagnosis and tell a kid you're da 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 da. They're hearing information from the judge, hears the information from the GAL or the lawyer, and which typically comes from the parent. And that's where we have to be. We need to get consent forms signed to speak to these lawyers and GALs so we can give our reports. Also advocate for the youth to get the appropriate assessments such as psychologicals, those types of things, and write letters on behalf of these youth and what we're seeing, and if they're participating in treatment, what does that look like? Are they resistant? Are they not resistant? And writing to them, talking about what our recommendations are. I've seen where the judges have considered our recommendations and have made it mandatory. That's why I said that the judicial system can play an integral role if they are not in the way.
right.
If they are understanding and willing to like take and consider what we have to say, because we're the ones working with them on a regular basis and meeting with the providers. The judges, though, they don't meet with us. They wait. The day of court is when they read all the information and then make a determination, ask some questions, witnesses, the kid, the family, and then make a determination. But we can advocate by putting paper to pen and getting consent forms for the courts.
Right, and that's usually if the child is in services. But I guess I wasn't clear on my question. It's just your thoughts. The child has not even been served. Had a diagnosis maybe 5 years ago.
Yeah.
Family hasn't kept up with any type of services for the child. But sometimes the parent is very quick to say, when my child has been diagnosed with, and then the like you say, the GAL, and sometimes the probation officer, they'll just throw that out there as well. But it's like everybody just want to throw a diagnosis around, but nobody actually says, let's find out what's going on. Let's do it. Let's do a psychological eval. Nobody ever says that if the child hasn't been in services. I was just wondering what your thought is regarding the judicial system, who just likes to throw those diagnoses around.
All right. Yeah. It's unethical. Like for anybody to throw around a diagnosis, I don't care if it's a judicial system, TikTok, anybody throwing around diagnoses randomly on a person and not knowing anything like the background. Again, I want to go back to what the keynote speaker said, how she went in and she was diagnosed with bipolar disorder, borderline, this, that, and the other. No one thought of considered the trauma.
Yeah.
We do this all the time. A lot of our youth and a lot of people in general are getting misdiagnosed with all sorts of other things, and they're leaving out the unspecified trauma or the PTSD. So the symptoms are so similar. So it's unethical for anyone who is not a mental health / medical professional to diagnose any human with not full assessment information. What they should do is, in that case, ask questions about, okay, are you in therapy? What treatment are you? If your mom is saying you are ADHD or whatever, right? That's what treatment are you participating in? That's my next. If you're coming to me as a judge, you have behavior problems, these whatever diagnosis they say that you have. My next question should be: are you in any type of therapy? Are you in any type of treatment? Do you go in groups, individual, TDT? In home? What is your intervention history? That's what I would want to know as a judge. That's the next question. If you haven't had any interventions in 5 years, okay, so then I need to instead of sending you to detention, I don't, depend on whatever the charge is, but I also need to look at mandating that you go to some type of treatment.
Right.
Again, that is where I see the judicial system as an integration. They are helpful when those things are mandated. Because sometimes we can't get anything done if it's not mandated.
Correct. And it's sometimes when they're not helpful, it becomes a barrier because they're not
Yes.
trying to, how to, as my daughter always say, how do we get here?
How do we get here?
Yeah.
It could be a huge barrier. Like I gave the description of the rural community who they just like, they're functioning like they're in the 90s. And it's like, the kid is the problem. Because mandating the child to treatment also, sometimes the family needs to do things too. If I'm hearing there's like you and mom or dad are fighting, it's all these different issues. Mom is non-compliant with school stuff. Okay, you have to look at things from, y'all need family therapy. Mom, the parents need a psychological. I've seen where courts have done this. And it could work, but it can definitely be a barrier and a hindrance to any type of progress if they are just like, okay, we'll go by your diagnosis. You're the problem. Lock you up. All you're doing is setting this kid up for a life.
Yes.
In and out, in and out. That's why I'm very cautious about detention and things like that too. Again, sometimes in the case I described in the presentation where it was necessary because this kid was overdosing. So he violated whatever probation he was on. So they put him directly. It needed to happen because there was a holding place for him to go to residential. If that didn't happen, I don't know if this kid would be here. I'm telling you, he was overdosing each and every time he got out of the hospital. And it was scary, like everybody's on edge, right? So, okay, that's when the judicial system did its due diligence and then mandated the kid go to treatment. But if you have that other attitude, just like, okay, lock you up, that's a setup.
It is.
And unfortunately, in Black communities, that seems to be, because when I talk about misdiagnosing, that's a whole other topic.
Oh, yeah.
I've seen where like all these other white kids, they get diagnosed with autism spectrum disorder. It was on a blackboard, the same behaviors. It's not considered because he's bigger. He's more aggressive. He looks different. So you're just oppositional. But you literally had some of the same symptoms that the little white kid does.
Oh my God. My daughter and I was just having the same conversation last week, literally the same conversation last week.
Yes.
But the parent is uninformed.
Yes.
Everybody's uninformed. They still looking at this kid as like just defiant and just aggressive.
Well, I've seen I've seen a lot. I'm a LCSW at a detention center in the city of Richmond. So I've seen a lot where the white kid has intermittent explosive disorder and the Black kid has disruptive mood disorder. It's the same symptoms.
Same symptoms.
Mhm.
But the Black kid is in like, oh no, we need to get rid of them judicial system. Wait a minute. Has somebody did a psychological on this kid? These symptoms are giving, maybe this kid is on a spectrum. Maybe they're being triggered.
Yeah, just like ODD.
Just like the little white kid. When we send a little white kid on, they get the help, them and their family. But when you got the parent that's uninformed, you got the kid that's just in a specialized school, IDDD, that's the label. It is not looked at the other mental health symptoms, ADHD. They got everything else under the sun, DMDD, ADHD, everything under the sun listed, but not looking at that this kid really may have a neurological disorder that can be treated.
Trauma. It may be trauma.
Or trauma. Because, when you have those presenting issues, trauma is lurking around the corner.
Yes.
It could literally be trauma. That's the other thing a lot of our kids are misdiagnosed with. Everything else under the sun, but missing the PTSD and some of the environments that they come from. So again, they get caught up in the judicial system, and that's when it is not beneficial. Because you just get another one. Oh, what's your address? I seen this family name again. It's just, but we can advocate. If we see these kids, we could play a huge role in changing the game.
Yeah, definitely.